What is a bone marrow aspiration? Bone marrow is the soft, spongy tissue in the bones. It is responsible for the production of blood cells, red blood cells, white blood cells, and platelets. Since these blood cells die after a while, our body has to continuously produce new ones. That production process starts with our stem cells, the mother cells of all other blood cells. If a stem cell becomes diseased, it can give rise to abnormalities in certain blood cells. In this case, it is necessary to examine the bone marrow via a bone marrow aspiration. A bone marrow aspiration is an examination in which bone marrow cells are removed for testing in the laboratory. This is done by pricking the bone marrow cavity with a thick, hollow needle. It is usually done in the pelvic bone or sometimes in the breastbone. When a bone marrow aspiration is performed, a small amount of fluid and cells are aspirated using a syringe with a fairly long needle. At the same time, a piece of bone may be removed for examination using a bone drill. This is called a bone marrow biopsy. The result is then examined under the microscope by an anatomopathologist. This examination is mainly carried out to diagnose blood or bone marrow cancer, identify a deficiency or excess of red blood cells, white blood cells, and/or platelets in the bone marrow, determine whether the cancer has spread to the bone marrow, determine the effect of a treatment. A bone marrow aspiration is usually carried out under local anesthesia and takes 15 to 30 minutes. It is generally not very painful, but can be experienced as unpleasant because, despite the anesthetic, the moment of aspiration can cause a short but intense pain sensation, similar to an electric shock, which can radiate to the toes. The bone marrow biopsy is taken with a twisting, drilling motion and may cause a feeling of pressure. The examination takes about 10 minutes and is usually painless. After the examination, you must lie down for a while in order to exert good pressure on the aspiration site. The aspiration site may remain sensitive for a few days. To reduce the pain, you may take paracetamol. Tell your doctor if you are allergic to any medication, if you are pregnant, and/or if you have bleeding problems and take medication for this. You can temporarily stop taking blood thinners if your doctor tells you to. For anxious patients, pre-medication may be used in consultation with the doctor 30 minutes before the examination. If you have any other questions about this topic, do not hesitate to get in touch with your healthcare providers at the hospital.